Hello and welcome. This is Bhaskar Napte from Pharma Growth Hub. And as a part of today's discussion, we will try to understand how to handle the change in the monograph. There could be possibility that your monograph may get changed due to the change into the analytical method or due to both change in the analytical method and the specification. And the third, now your monograph has only changed with respect to the specification, but there is no change into the method of analysis. So we will try to understand how to handle these three different situations one by one. So let us begin our discussion with the very first point, change in the monograph method, but no change in the monograph specification. So if I have to explain this point, means let us say you have the related substances parameter in a monograph and the method for related substances has now got changed, but there is no change in the specification of the related substances, maybe with respect to your known impurities or unknown impurities or total impurities. So everything just remains the same, but only there is a change into the method of analysis. Let us talk about the first point. Now when can you continue using existing method, and when can you adopt the revised monograph method? Now, these are the two important points we are going to discuss right now. Let us start with the first point, when you can use the existing analytical method for maybe related substances, the way I explained with the example. Remember, your specification has not got changed for the parameter. Only the testing procedure has got changed. So when you can use the existing method, let us understand the first point. If your existing method is either superior or at least equivalent to the revised monograph method. So you have to conduct the method equivalency study and you have to demonstrate that at least your existing method is equivalent. And if it is superior than the monograph method, then there is no question about why you cannot use the existing analytical method. The second point, if your revised monograph method itself is not found suitable for your product, there could be some interference coming out of your sample matrix, and because of that, this I mean there could be some interference coming out of the sample matrix in the monograph method, isn't it? So your specificity has got compromised, and because of that your monograph method will not be suitable for your product, and hence you cannot propose the existing your monograph method. You can continue by using the existing method. The third important point is, in case if you want to retain your existing analytical method, you have to file the proposed change during the annual reporting. This comes under the minor change, and hence it can be done during the annual reporting. So in case if these 3 points gets fulfilled, first one is method equivalency between existing and monograph method. The second point, if your monograph method itself is not suitable for the product, and if you actually report the retaining the existing method in annual reporting, then you can certainly use your existing method for, even though there is a change in the monographs testing procedure. I hope you are clear with the very first point. The second point is, when can you adopt the revised monograph method now? See, we are discussing the first point where there is a change in the monograph method. However, there is no change in the specification as it is. So let us talk about how one can go for the adoption of the revised monograph method. If revised monograph method is either superior or at least equivalent to the existing method, then you can go for changing the method to the monograph method. If method verification for revised monograph method is successful, because you have to also conduct the method verification, and if the method verification for a monograph method is successful, then you can continue using the monograph method as well. The third important point is, this comes under the moderate change, and you have to uh, find the CB30 change. This needs to get approved, and then you can continue using the now revised monograph testing procedure. So this is the first point we talked about, when there is a change in the monograph method but no change in the monograph specification. Let us talk about the second point. What is that? The second point is, now there is a change in the monograph as well as the specification. I mean, your related substances method also has got changed, and there is also change in the related substances specification, maybe with respect to the limit of impurities, or maybe there is a new added impurity into the monograph now. So how to handle such kind of changes? Let us first understand when you can continue using your existing method. Remember, now there are two different changes happen. There is a change in the method and also change in the specification. Let us try to understand how one can continue using your existing related substances or any method for that sense. So if your existing method is either superior or at least equivalent to the revised monograph method, you can continue using your existing method. If you prove that there is no impact on existing methods performance due to change in the monograph specification, then certainly you can continue using the existing procedure. Let us say there is a change in the impurity specification from 0.1 to 0.2%, got little bit relaxed. And if you prove that, okay, with the 0.2% impurity content also my method performs well, then you can certainly continue using the existing method. Or if there is a new impurity added into the specification, and if that newly added impurity is also getting well separated, eluted into your existing method, you can certainly use the existing method, provided you have to conduct the required partial validations. You have to understand what is the parameters which needs to be considered for the validation now. So those partial validation needs to be completed successfully. The fourth point, if revised monograph method itself is not suitable for your product, you also proved that the existing, your monograph method is not suitable for your product, then there is no question about using that monograph method. And if you update this in annual filing that I am going to retain my existing method, even though there is a change in the specification and change in the method in the monograph. I hope you understand in which situation you will be able to continue with the existing method when there is a change in the monograph method and change in the monograph specification. Let us now understand when you can adopt a revised monograph method. The point number one, if impact on existing methods performance is observed due to change in monograph specification. See, we are discussing about second number point, which talks about change in the method and change in the specification in the monograph. And let us say there is an addition of impurity in the specification, and that impurity is not found to be, let us say, eluting or well resolving into your existing method for related substances. So that will disqualify your existing arrest method, and in that case you can certainly go for the revised monograph method. If revised monograph method is either superior or at least equivalent to the your existing in-house method, whatever method it can be, which is existing, then you can certainly go for the even the newly added revised monograph method. And if method verification for revised monograph method is found successful, which is the important point, and if the CP30 change for proposed revised monograph method is approved by the authority, I'm talking about the US FDA point of view. So we talked about the second point where there is a both change in the monograph method and the monograph specification. And we understand when the existing method can be retained or when you can go for the adoption of the new revised monograph method. Let us now try to understand the third part change, kind of change. There is a change in the monograph specification, but no change in the monograph method. So monograph method has remained same, but only specification has got revised. Let us now understand. In such situation, when can you continue using existing method? Point number one. If no impact on existing methods performance due to change in the monograph specification is observed, isn't it? There is only change in the impurity limit in case of related substances, and that change in the concentration or specification does not have much impact onto method's performance, then you can certainly continue using your existing method. If required, partial validation with the change specification is done and it is found to be successful and suitable, that will help you to continue using the existing method, and you need to update this during the annual filing that yes, I am going to continue using the existing method even though there is a change in the specification. My existing method stands valid for the stands suitable for the intended purpose with the change specification. Okay, so now the second point is when you can use monograph method if the existing method is in-house. You know that now in this situation, only the specification has got changed, the monograph method has not changed. But for some reason, you have your in-house testing procedure. So how you can go about this particular change? How you can actually adopt the monograph method? The point number one, if impact on existing in-house methods performance is observed due to change in monograph specification. Let us say you are talking about related substances and there is an addition of new impurity. So if that new impurity is not well resolved or retained onto the existing related substances testing procedure, you cannot continue using the same testing procedure. In that situation, you can certainly go for adopting the monographs method. The second point, if you actually use the monograph method for your product and if that method is found suitable for your product, then you can certainly adopt the monographs method. But that alone will not suffice the requirement. You have to also conduct the verification of the monograph method, whether the monograph method is really suitable for intended use or not. And finally, you have to also file CB30 change, and the CB30 change needs to get approved. And after that, you can certainly use the monograph method. I hope you got the clarity now when you can have the, I mean, how you can handle the three different kind of changes. The first one was change in monograph method, but no change in monograph specification. The second was change in both monograph method and monograph spec. And the third was change in monograph spec, but no change in the monograph method. Thank you so much.